Hey everyone. I just wanted to jump on here really quickly to address some really significant news. As I'm sure a lot of you guys have heard, former President Joe Biden has been reportedly diagnosed with an aggressive form of prostate cancer. Now, this is deeply concerning news, and I just want to start by saying that my thoughts are with him, his family. This has to be a very challenging time. Now, I know that you're probably seeing a lot of news about this. It is sort of breaking news. And while I'm not interested in diving into the politics of all this, I do think that this case should serve as hopefully an opening to a long overdue conversation about a major issue that affects millions of men worldwide every single year. Now, according to reports, the cancer has metastasized to his bones and carries what's called a Gleason score of 9. This indicates a high-grade, aggressive form of the cancer. Gleason score is a system used to evaluate the aggressiveness of prostate cancer by examining how much the cancer cells differ from normal prostate cells under a microscope. With this system, the scores can range from a 6 to a 10, and higher scores signify a more aggressive cancer. So a score of 9 places this cancer in a higher grade. It would be what's called grade group number 5, which is the most severe category of prostate cancer. What's particularly striking in this case, and what kind of caught my attention, is the timing of this reported diagnosis. Reports are saying that the president was experiencing urinary symptoms, which led to the discovery of a prostate nodule and subsequent diagnosis. To me, it's a little concerning that such an advanced stage of cancer was only detected after the symptoms already became apparent. Now, just to break it down for you guys out there, for anyone who isn't familiar, we can talk a little bit about how prostate cancer is usually discovered. So, this is something that I do see in my urgent care clinic. For many men, the first signs are usually urinary symptoms like difficulty starting urination, a weak stream, getting up frequently at night, and sometimes blood in the urine. But sometimes there are no symptoms at all until the cancer is advanced. I'm not saying it's impossible. It's just not very common. Now, the most common screening tool used is a simple blood test called the PSA, or prostate-specific antigen. A higher than normal prostate-specific antigen can be a warning sign. It doesn't always mean that there's cancer, but sometimes it's caused by other things like an infection or an enlarged prostate. But if PSA is elevated, or if your doctor feels like something unusual is there during a rectal exam, the next step is usually a prostate biopsy. And that's where samples of prostate tissue are taken and looked at under a microscope. This is where the Gleason scale, which we talked about, comes in. The pathologist grades the tissue based on how abnormal the cancer cells under the microscope look. And from there, doctors use imaging like an MRI or bone scans to see if the cancer is spread to other places. And this is what helps determine the stage and guide treatment. Now, I'll talk a little bit about treatment options. I'm not a urologist. Typically, I'm referring to a specialist to sort of have this conversation. But in general, treatment options typically depend on the patient's age, their overall health, and the stage of their cancer. For early stage cancers, some men might only need active surveillance, just keeping a close eye on things. But for more aggressive or advanced stage cancers, treatments can include surgery to remove the prostate. That's something called a prostatectomy, radiation therapy, or medications that lower testosterone, like Leuprolide, also known as Lupron, which you may be hearing out there. Other advanced therapies can include neurohormonal drugs and sometimes chemotherapy. Now, the important thing in all this is that prostate cancer is highly treatable when it's caught early. And the options are getting better and better every year. So as an urgent care provider, I want to emphasize this particular point, okay? I often see male patients who come into urgent care clinic with urinary complaints and then, upon further investigation, are diagnosed as prostate cancer. And for a lot of these guys, they delay coming in to see the doctor for months, sometimes even years, ignoring the symptoms and pretending like nothing was going on until finally they can't ignore it anymore. They show up and we find the diagnosis. Now, of course, I don't know if any of this applies to President Biden's situation. As many people out there may or may not know, the president is reportedly one of the most medically monitored and supervised human bodies on the face of the earth. So, it's hard to understand how, screening like PSAs wouldn't have caught this earlier.
It's a necessity to deal with making sure it doesn't become one.
Do you think it's a mistake in New York to withdraw the vaccine mandate for private employers?
No, I don't think. That's a local judgment. Thank you.
But in any case, I think that this whole situation underscores the importance of routine checkups and not ignoring urinary symptoms. Like I said, prostate cancer is one of the most common cancers amongst men, and an early detection is crucial. Now, another part of the irony here for a lot of guys who don't get this checked out is that prostate cancer is also one of the easiest types of cancer to screen for and to track. For men over the age of 50 or those with a family history of prostate cancer, you should get a routine screening. It's a simple PSA test. That's usually all that's needed to accomplish the screening, and you can catch this early. So to wrap this all up, I think that President Biden's diagnosis should serve as a stark reminder of the importance of proactive health screenings. Here's my message to all you guys out there and why I'm making this video, because like I said, I know this is a breaking news story. You're probably seeing all kinds of different sources for information. And my message is this. If you or someone you know is experiencing urinary symptoms or is due for a routine yearly checkup, please don't delay in consulting a healthcare provider. All right? Now, I'm sure this whole story is still evolving and more context is probably going to be revealed as sort of time goes on here. But for now, I think we should all use this moment to sort of reflect and prioritize our health and encourage those around us to do the same. Okay? Stay healthy out there. Take care of yourselves. And as always, stay dynamic. Peace.